am from Ames University. I came with my group. So today we came here to conduct this interview. It is because that it's part of our task in EPP. Could you briefly introduce yourself in terms of your working experience and your profession?
Okay, I'm Liu here. I'm working as a cardiologist here in Pantai Hospital. I've been here since I think 2012. Before that I was in GH. I've been in GH for 18 years. After that was in Amoy for a few more years. So currently I'm working here as a cardiologist here, interventional cardiologist. Okay.
So where did you graduate from?
UC Malaysia.
That's a good school.
Is it?
Yes. So what inspired you to be a doctor and later on specialize in this course? Is it like due to your influence from your surrounding, the people that surrounds you, or is it your personal interest?
I think partly personal interest, partly probably influenced by parents, or not really influenced by good parents, and partly maybe the time result was okay and accepted medical school altogether.
Is it stressful to go for these specialized courses because like usually they have these packed courses and then you have to juggle between your social life and your study life?
Definitely very stressful, especially during your training. I think practically you have not much social life. And you probably spend most of the time in hospital, especially doing a field like cardiology, which is actually very exciting and then full of emergency and not unanticipated. Or you have to attend the emergency even in the middle of the night, so it can be quite stressful sometimes. But it's actually a very rewarding job, and actually we most of us really enjoy our work.
That's great. So, as a cardiologist, it's best to get your opinion on this. So, who is more prone to having this heart disease?
Okay. The commonest group to have this heart disease are those, you said, men above 40. Normally we look at the risk factor. Risk factor means the risk of getting heart disease, which is due to the buildup of cholesterol plaque in the coronary artery. So the commonest group are those men who smoke, who got history of diabetes, high cholesterol, high blood pressure, they got very strong family of heart disease. But women are not spared now. We have seen young women, younger and younger, they are getting heart disease, especially if they smoke, if they have diabetes.
What is your most commonly seen heart disease in your clinical practice?
In our clinical practice, we see various kind of heart disease. And the commonest heart disease that we see is a coronary artery disease, which are the disease that affect our coronary artery. So coronary artery is the artery that supply the heart muscle. So the commonest cause of the pathology that affect the coronary artery is the arteriosclerosis, which means commonly we say as cholesterol plaque. Build up of cholesterol plaque in the artery. So this is the commonest disease that we see almost every day. We have lots of patients coming for this complaint with this complaint.
So what are the symptoms for this disease?
They can present in many ways, but a lot of times the one that we most dreadful one is heart attack, or we call myocardial infarct, which is due to a sudden blockage of the heart artery, which actually compromise the heart muscle, and within hours, if the blood flow is not restored, the heart muscle will be damaged. That's what we call myocardial infarct. And it carries very high mortality if it's not treated well. Another way that it can present is what we call angina pectoris, which is a chest discomfort that they get it when they exert For some of them, they can even present as what we call silent whiskey. They're totally silent, and they also they pick up during exercise stress test. And some of them they may present with sudden cardiac death, or they die suddenly, or they can present with arrhythmia, means irregular heartbeat. The worst still, because of recurrent heart damage, they present with symptoms of heart failure. Also, these are the many ways that heart disease or chronic heart disease may present.
So doctor, what kind of treatment do you usually recommend for the patients with this kind of disease?
So as we say, we can divide the treatment into what we call a prevention and also the treatment. So I think most important, we need to prevent it. As we know, coronary heart disease is caused by many causes. There are many causes like smoking, high cholesterol, diabetes, hypertension, and also family risk and the genetic predisposition. So so we have to aggressively treat all the risk factors. Means bring down the cholesterol level, treat their diabetic well, control the blood pressure, and also advise them to quit smoking. And if they present with heart attack, we can actually give either medicine to dissolve the clot, like say heart attack clot, or we can do angioplasty, which is a mechanical way to suck out the clot, open up the urine, and restore blood. So generally, there will be 3 modes of treatment. Medical therapy, if the narrowing is not severe. Second, if the narrowing is severe, they're symptomatic, we can treat them with angioplasty with stent. The third way, if the disease is very severe, we think that the angioplasty is not feasible, then we may need to go for bypass surgery. So these are the 3 major treatment modalities.
So doctor, what is angioplasty?
So angioplasty is an invasive procedure in which we involve introduction of the stent into the vessel. I can show you the model. So you can see this is our This is our artery that supply the heart muscle. So what we do, we can do it either from a radial, means from the hand approach, radial artery, or femoral. And most of us, we carry it out through the radial approach, through the artery, and then we introduce a tube which is called catheter. And from the catheter, then we can introduce all our hardware through here, through this lumen. You see, there's a lumen here. So once you introduce the catheter here, then you can introduce a wire. That's how you can see from here. If this, let's say this is a cholesterol plug. What we do is that you put the wire, deliver the wire, or try to maneuver the wire into the narrowing segment, and then from the wire we track a balloon or stent. This is a picture of the stent being there, and then this is the stent that is not deployed, means not inflated yet. That's how a stent is introduced in the body. It is creamed onto a balloon. There's a balloon there. The stent is usually made of stainless steel or cobalt chromium. So once it's introduced and we think that position is okay, we will deploy the stent. Means we inflate the balloon inflate, expand the stent to the diameter of the vessels. So when the stent is expanded, the balloon will be withdrawn, and then the stent is left behind. This is how it works. So you can see the stent here, it compresses the cholesterol plug and force open the lumen. So that's how it restores the blood flow in an obstructed vessel. So this is what we call balloon angioplasty. It won't degenerate, but what happens that it will be endothelialized, means that after 3 months, 6 months, healing process will happen. The normal tissue, or we call endothelial cell, will grow over the vessel, and then after 1 year, it will be covered by this endothelial cell and some scar tissue.
What is bypass?
So bypass practically is a more invasive procedure. It involves surgery, surgery that we need to do a sternostomy. We need to that means cut open the sternum. And then after that, a new vessel, or either we can take it from the vein, from the leg, or from the chest wall and artery. And then what we actually do is that we will actually, it's done by surgeon. We will join this part here. You know this aorta, isn't it?
Yeah.
Let's say this is a stenotic segment, obstructed segment. The new vessel will join from here and join to here, this segment. So practically it will bypass the narrow segment, and now blood flow will come from here, going to the bypass artery and supply the blood to the muscle, or bypassing the stenotic segment. So this is called coronary artery bypass. So usually it involves multi-vessel disease only we send patient for bypass surgery. So usually they have many graft. The graft is a new vessel that we implant. So into the vessel. Okay, so these are invasive surgery. It involves more complication, but then the long-term result is better than stenting. So, but because it's invasive, it takes longer time for recovery.
So doctor, for statin drug, because it's known to reduce cholesterol, right? So but because I've heard like if you take in statin drug, you actually could actually lead to kidney disease. So do you actually recommend patient to take statin drug?
You heard this? This is what we call statin controversy, but they have never mentioned about kidney disease. So I think, I'm sure you all have got all this from the internet, isn't it?
Yeah, I think.
Yes. So but all these are, we are not sure how you get all this information. But based on the studies and thousands of studies involving millions of patients, the incidence of kidney disease is no different from those who are not taking the medicine. And it rarely causes kidney disease. And the common side effect of statin is there, but it's also not very common, probably less than 1%. Common side effects are sometimes liver dysfunction, we have muscle pain, and about 5% of patients may develop diabetes. But then you look at the benefit of statin, it helps to prevent heart attack, helps to prevent death. So the risk-benefit ratio is definitely very low. So I think the benefit is far outweigh the risk. So we would encourage all our patients with heart disease, established heart disease, to take statin.
How do you rate the level of public awareness on this cardiovascular?
It's getting better and better, especially in Malaysia, in big city. I think a lot of them are coming to see us for health screening, exactly the health screening. And also, I think a lot of all these MNC, they make it a requirement for the staff to come for yearly screening. Also, more and more are detected earlier and treated earlier. I think it's improving. But I think in rural area, it's still lagging.
Do you have any special cases or like unforgettable experience on any case?
Next one. We have got many.
So you can't remember.
Yes, can't remember. Yes.
So like, how do you feel on your current job now? Are you like satisfied or really stressed?
Now I think we have reached a stage that we are more balanced. We can juggle between our family life, working life, and social life. But during training, it can be very stressful. And like I said, you hardly have any social. Once you finish your training, usually it's long training, or especially subspecialty training. So you generally it takes about 10 years after your undergrad. Almost 10 years. So for 10 years, almost have practically have no social life. No, it's not that bad. And now it's more balanced. And in private, you have to work as a houseman, a medical officer, and as a specialist. You have no houseman to help you. So if you have emergency, middle of the night, you still have to come.
Yeah, the on-call one.
Exactly, if you're on call. So, but after so many years, most of us got used to it. And I think in private, we are quite fortunate that not that many emergency. Probably that most of them are well treated.
Yeah. So how do you visualize the future development of medical field in like maybe 10 years or what?
Yeah, getting more and more advanced. It will be a lot of them will be technology based, and you are using a lot of high tech equipment, high tech technique to treat heart disease, to detect disease earlier. And in future, they may even talk about gene therapy or to individualize treatment patient. But this probably won't happen in the end. It's probably many more years. But there's a lot of research going on in this field. But in terms of cardiology, they have made a lot of advancement from the day that they start treating heart attack with rest. After that, with medication. Now with invasive treatment like angioplasty. And now your angioplasty, the stent getting better and better. And then now, before for valve treatment, the only way is surgery. But now for those who can't go for surgery, now they can do it through percutaneous, non-invasive. So a lot of advancement, especially in the field. I'm sure this happened to other fields too.
So do you have like any advice or encouragement for those like currently studying this medical field? Like
I think most important thing is interest and also the attitude. I think interest and attitude is the one that will keep you going. Exactly. I think whatever you do, you need to have a good attitude.
Yeah.
Isn't it?
Yeah. Okay. Thank you for your time, Doctor.
Okay, welcome.